Have you heard of chemical pregnancy before? Chemical pregnancy is an early pregnancy that occurs before fifth week of gestation. It always happens because there is always interruption of the implantation of the fetus. Normally, the fetus is expected to be implanted in the walls of the uterus, but for so many reasons, there is no implantation of the fetus. So it causes the chemical pregnancy to occur. And take note that when you check the ultrasound cannot detect the presence of the gestational sac. My name is Victor. Please, if you are first time of coming across my channel, please do well to subscribe. My channel is more of human health, mental health. Subscribe so that you see more of my videos. What are the causes of chemical pregnancy? Chromosomal abnormality. If the fetus cannot be able to form properly as a result of abnormality in the chromosomes. Another one is hormonal imbalance. All of us, we know that progesterone are the hormone that is responsible to sustain pregnancy. If it is low, it can result to chemical pregnancy. Some disorders like thyroid disorder, diabetes mellitus, hypertension, if they are not properly managed, interrupts the development of the fetus. We have uterine abnormalities. If there is a partition to the uterus, presence of fibroids, polyps can interrupt the development of the fetus, thereby resulting to chemical pregnancy. Age contributes also here. And the mother is advanced, that period there will not be production of quality and enough eggs. So if there is no enough egg that been produced, it will result to chemical pregnancy. Untreated chronic infections such as sexual transmitted infections, syphilis, gonorrhea, HIV, hepatitis, it can result to chemical pregnancy. Lifestyles, smoking, lack of exercise, excessive alcohol intake, excessive caffeine intake can cause chemical pregnancy. Stress, whether physical or emotional stress, can result to chemical pregnancy. So it's very important that you always keep your mind at a good state. Ensure that your mental health is in good state. Inadequate or delayed implantation. If the implantation of the fetus is not adequate, or there is a delay in the implantation, after conception, the fetus is expected to go up to the uterus and attach itself at the wall of the uterus. But if there is a delay, or if there is no properly attachment of the uterus to the wall of the uterus, there will be chemical pregnancy. Medications, that's why it's important for you to know the kind of medication you take during pregnancy, or even as a woman that is trying to conceive. Ensure that you don't take medication without doctor's prescriptions. There are some herbs that can harm the developing fetus. So it's very important to be very, very careful. The kind of medications you take, the kind of antibiotics you take, the kind of herbs, mixtures you take as a pregnant woman. Because you might not know that when the pregnancy sets in, especially in this chemical pregnancy, it happens before fifth week of gestation period. So sometimes you might not know. You just detect that, when I check, I'm pregnant, and few days the pregnancy disappeared. What are the symptoms to show you that this is chemical pregnancy? There is always faint positive pregnancy test. Maybe when you check at home using that pregnancy strip, you notice that there is a positive line to detect that the pregnancy is positive. First line is always faint. Secondly, there is mild cramping. There is always cramp at the lower abdominal, and also it can come with vaginal bleeding, or even spotting. It doesn't come in a heavy form, but you might liken it as a normal period. Instead of your period to flow like 3 days, 4 days, notice that it's extended to 7 days, 8 days. Short-lived pregnancy symptoms. Of course, you know the early signs of pregnancy: nausea, fatigue, you'll be tired, you'll be breast tenderness. They are always present. The pregnancy symptoms will not last. They are always short. I used to feel nauseated, tired, my breast is always tender. All of a sudden, those symptoms will disappear. Know that this is chemical pregnancy. The timing of the bleeding can make it difficult for you to distinguish between your normal period and this chemical period, because they almost happen at the same time. But the fact is just within short period of time, within 5 weeks of gestation, So you might likely it to be your normal period. This period is kind of prolonged and heavier than normal. Ultrasound, when you check, the ultrasound will not detect any sign of gestational sac. How can you diagnose this chemical pregnancy? First, home pregnancy test. You can decide to use that pregnancy strip to check, dip it in the urine, early morning urine, check if the strip has 2 lines, because normally if there is presence of 2 lines, it's showing that it's positive. In this chemical pregnancy, the line, the first positive line, is always very faint. Blood test to check. Blood test is the advanced level of checking for pregnancy. You use blood, unlike using urine. You can still see the presence of that HCG. Pelvic scan to check if the gestational sac will indicate that there is still growing fetus. But when it's absent, it means that the fetus is no longer surviving. That means the chemical pregnancy has occurred. How do you prevent chemical pregnancy? Nutrition is very important. Eat balanced diet. Food that are high in fiber, iron, and vitamins, they are very good. Then also exercise. Ensure you maintain a good normal body weight. Always check hormonal levels. Progesterone is the hormone that is responsible to maintain the pregnancy. If it is always low, know it that this chemical pregnancy will keep occurring. Medical screening is important. Genetic testing to check if there is any chromosome abnormality, if there is any uterine abnormality. Then check for your BP, thyroid disorder, diabetes. If you have anyone, please ensure it is properly managed. Treatment, it normally resolves on its own. It doesn't have a special treatment. Unlike the other type of miscarriage, I need to go to hospital, they'll use medication or surgical treatment. This one normally resolves on its own. You'll be fine. Just prepare your mind for another pregnancy. Note that this is not your fault. It has happened. Accept it. Have faith that you can still conceive, because you have the tendency to conceive more. Just ensure that you detect what causes it previous time and avoid it. Seek for treatment, seek for help. So far.